Jorge Colon. I help Dr. David Lee here at the Center for Veterinary Business
Recording
and
in
Entrepreneurship.
progress.
And I serve as the Director of Veterinary Business Education here at the college. And we're happy to have Dr. Katie Fish, good friend of ours, talking about the business of mentoring, something very important to our students. Dr. Katie Fish received her DVM from Cornell in 2004. She practiced as a small animal general practitioner at Princeton Veterinary Hospital until 2020, when she moved into a full-time mentorship role supporting early career veterinarians across 17 hospitals for Monroe Veterinary Associates in Rochester, New York. NVA partnered with Thrive Pet Healthcare in 2021, and Dr. Fish began to grow her involvement with Thrive's Doctor Mentorship Program, while still doing boots on the ground mentorship in Rochester. Since 2023, Dr. Fish has led the Doctor Mentorship Program for Thrive and is the Director of Mentorship Programs, while continuing to enjoy working with mentees in the field as a regional doctor mentor. Outside of work, Dr. Fish plays violin in several community orchestras and loves to travel. Just a quick reminder that we're recording this session and we'll make it available to watch later on our CVB website. With that, thank you, Dr. Fish. We'll have you here in a second. I want to make sure that I thank our partners in the process of bringing you our services through the CVBE, the Triad Foundation, Veritas Veterinary Partners, Zoetis, IDEX, Boehringer Ingelheim, VetTriage, VPP, Encore Vet Group, Care Credit, and Purina. So thank you all. Thank you all for coming. Thank you to our sponsors. Dr. Fish, all yours.
Awesome. Thank you so much. Thanks for the intro and thanks for having me and for everyone for coming. So yes, today I love mentorship. We're going to talk all about mentorship and my goals are to kind of give us a overall theoretical look at mentorship, but also include some really practical tools that you can use in your practices in terms of mentoring associates. And within that, we'll look at what the fundamentals are to any mentoring program, whether it is a large-scale national program or whether it's a one-on-one mentor-mentee relationship in a practice. So this is my kind of simplified view on mentorship. And I like it because I think it really does come down to my two goals when I'm mentoring are to promote medical excellence and ensure doctor happiness. So the medical excellence side of things, I think that comes, is pretty straightforward for us. We want to be sure that we're equipping our doctors to provide exceptional medical care for their patients and their clients. The doctor happiness side of things, it sounds kind of warm and fuzzy, and it is kind of warm and fuzzy, but it's really, really important. And there's actually a very strong body of literature that demonstrates the importance of this happy doctor. And so what do we actually mean by that? What I intend to mean is that we're equipping our mentees with this professional skills to be able to execute excellent medicine, resiliency skills to withstand the challenges of our profession, and just giving them everything that they need to ensure longevity in the profession. If we can achieve those two objectives, excellent medicine, happy doctors, then all the other good stuff should flow from it. At our practice level, we should see that doctors want to come work with us and that we have improved retention. They want to stick around. We know that good medicine is good business, and so we should see an improvement in practice KPIs. And this is actually even more far-reaching than just the doctor team, because these attributes, medical excellence and well doctors, from a psychological and professional skill standpoint, they foster a positive culture within the practice that trickles down to all the other team members as well. So what is mentoring? There's lots of different definitions. I took several of my favorites and kind of combine them together to come up with this one. So it's a collaborative relationship in which a more experienced mentor invests in providing guidance, support, and knowledge to a less experienced mentee for the purpose of growing that mentee's competence and confidence in the profession. So I highlighted relationship because that is the core of any successful mentoring program. A strong foundational relationship between the mentor and mentee is absolutely essential for mentoring success. So in our clinical realm, we use mentoring to develop medical knowledge and reasoning, clinical skills, so our hands-on skills, surgery, procedural skills, professional skills. And so in that, I would include things like professionalism, communication skills, time management skills, and other leadership skills. And practical skills. So this is something that mentors can have a really profound impact in, and I think we often don't think about it as much. But practical skills like how to be effective in the role, setting boundaries with clients and with team members, and balancing work and family, personal financial planning. So these things that are important aspects of being a human being, and how do we weave them successfully into our profession? And so when we're mentoring, we're going to use lots of different tools, including teaching, coaching. Here's relationship development again. We're going to help guide goal setting because goal setting we know is really important. It's one of the things that's shown to help prevent stagnation and burnout in the profession. And so as mentors, we can be very insightful and valuable in helping to guide our mentees with goal setting. And just general socializing to the profession. What's normal, what's atypical, getting our mentees exposure to other colleagues and helping them to advance interests that they have. So, is it necessary? So we know that mentorship is the number one thing that new grad veterinarians are looking for in their first job. This is supported by a lot of different reports and surveys from organizations like the AVMA, the AAVMC, Mars has done surveys, VIN has done surveys. It aligns with, I'm at Thrive Pet Healthcare, it aligns with our vet student externship survey results. It's always at the top of what they're looking for. So in terms of recruitment, I would argue that it is necessary to be offering mentorship, but it's so much more than that. These, early career doctors are correct for wanting mentorship. So we know that mentorship is valuable at all career stages, but it's especially critical during periods of transition. So we think about the transition from student to practitioner. But we see other types of transitions within the career, across the career. So you might also think about a general practitioner who's moving into an ER role or vice versa, or an associate who is moving into a leadership position like a medical director position. Those are all really substantial periods of career transition. And so mentoring is always valuable, but especially important during those times. So here, this is a picture from my graduation at Cornell back in 2004. We know that nothing magical happens when we graduate. When we walk across the stage, we still have the same knowledge and skills and experience as we had before we got our diploma. So an experience is one of those things that it takes time to build. There's no way to magically instill somebody with years of experience. I have heard people say, well, isn't vet school supposed to prepare students for the profession? And my answer would be yes. And we come back to this idea that transition is fraught with challenges and uncertainty. So for experienced practitioners, I think it's very easy for us to overlook how difficult what we do is and how much we navigate on a day-to-day basis. But if you try and take a step back and look at it from the perspective of a new grad going from school to practice, think about all the things that are new for them. So just kind of a short list here. This is probably the first time that they're carrying the full responsibility of patient and client care. We tend to be perfectionists in this role. And so we're trying to hold ourselves to extremely high standards, and are fearful of making mistakes that could compromise patient care. It's probably the first time that we're under the time pressure of an appointment schedule. Probably learning a new medical record system, while at the same time learning how to adjust. If you're going into a general practice, you're learning how to adjust medical record detail from what is expected in school to what is still complete and appropriate for general practice, but efficient. We're learning a new hospital operation and flow, and how to work with a new team, and meeting new people. And our new grads are essentially leaping from near the bottom of the leadership totem pole to near the top, if not the top, as they become a de facto leader within the hospital. So lots and lots of stuff that they're having to navigate, where we can be very valuable in supporting that. So additional reasons why it's necessary is that veterinary medicine is, one of the wonderful things about it is that it is a lifelong learning profession. We will always have more things that we can learn and ways that we can improve as clinicians. And so we need to help role model that to our mentees, and also remember that a lot of learning comes through experience, and our new grads don't have the benefit of that experience yet. So we can be role modeling self-reflection and continued learning, and also passing on our experiential knowledge to them. We also, and when you mentor others, I have a bunch of early career doctors who are mentees who love to mentor. And so it's kind of really cool to see this culture of mentoring be perpetuated in the profession. And it's one way that we ensure continued professional growth of our profession and excellence within our profession. We know that practice is hard, and in vet med, we face high rates of burnout and high stress situations. And so just to have other people in your life to help recognize, today was really, really difficult. Let's talk through it. That's mentoring as well. And then I'm very passionate about mental well-being in our profession. And I think one of the best ways to help address that is to not normalize that we have a problem, but to normalize talking about it. Decrease the stigma around talking about mental health and personal well-being. And my mentees know, or they learn very quickly, that when I have one-on-one check-ins with them, that we're always going to touch on how's your stress level, how's your well-being, and it makes it much easier for them to open up should there be anything of concern, when they know that this is just something that we talk about, with just the same as how's your appointment schedule going, how are your client interactions going. All right, so let's normalize some things about mentoring. To be a great mentor, you don't have to have a background in education. You don't have to be the best veterinarian. You don't have to be the most experienced veterinarian. I have some early career mentees who are fantastic mentors. You don't have to block your appointment schedule and give up your own practice to nurture a mentee. And you don't have to sacrifice your own well-being. And I would actually argue for those last two, blocking out your own appointment schedule, sacrificing your own well-being, is doing your mentee a disservice, because then you're role modeling behaviors that we're trying to teach them not to do. We're trying to teach them how to care effectively and efficiently for their patients and their clients. And we're trying to teach them how to set boundaries and attend to their own well-being. So we need to, and we're allowed to be good role models in that. So really, to be a good mentor, you have to care about your mentee. You have to, really care about their well-being and want them to be successful. We have to be willing to be available, so not necessarily 24/7, but we have to have a willingness to make that investment of time and our own personal resources. And we have to have great communication skills. It's also important to recognize that a mentee can have multiple mentors. So having multiple mentors doesn't mean that any one mentor is deficient or lacking. It just means that it's normal, and mentees have varied interests and needs, and mentors, we're all people too, and we have varied strengths that we can offer up to our mentees. So totally normal and appropriate for a mentee to have multiple mentors. And it's also important to note that mentoring needs often change over time. So when I think about longer periods of time, like mentors that I have in my life right now are very different than mentors that I had early in my clinical career. We also see mentoring needs change even over the course of the first 6 months of practice. What mentees are in need of and looking for at day one is often very different than what they need at month 6. And so having continual conversations and having this relationship between mentor and mentee to identify those changing needs is very important. And then a mentor, kind of touched on it a little bit earlier, but a mentor, we have to be aware of our own limitations. We can't do everything. We're not expert in every aspect of the profession and everything that a mentee may need. But as long as we have the best interest of our mentees in mind, we're going to be successful in supporting them. Okay, so mentoring program fundamentals. So these are the things that I think are essential to any mentoring program, whether it is a national program or whether it is a program that only it exists within the confines of a small general practice. They both can be equally as effective, but they all need to have these components. So we'll go through them all fairly quickly, and then there's several of these that on future slides we'll dive in a little bit more. So back to this idea of relationship, we have to have trust between a mentor and mentee. That is essential and the core of any mentoring program. We do have to have structure. So what are we actually offering? What's involved in the program? Is there a structured curriculum? Great, there can be, but there doesn't have to be. So it could be, if we're thinking about something within the confines of a small general practice, it could be as simple as the mentor and mentee have an agreement on, we're going to meet at a particular cadence and we're going to talk about these particular things. So that can be your structure. Or obviously it could be much more elaborate than that. We have to have clearly defined expectations of mentoring and practice, and this one's bidirectional. So the mentee has to have a clear understanding of what their expectations are from and what they want to receive from their mentor. And the mentor has to have a clear understanding of what their expectations are from their mentee. We need to share those back and forth and discuss them and meet somewhere in the middle. If a mentor has very specific ideas about what they need their mentee to do in practice, they need to communicate that so that the mentee is not misaligned on what they're doing. Mentees need access to support and resources. So the mentor is obviously going to be a great support and resource to them, but mentors, you don't have to bear it all. You can, ensure that your mentees have other sources of support, whether they're other people, other clinicians, or other types of resources. We need to have some sort of means of assessment. So I'm not talking about exams, but we need to have a way to assess progress over time to ensure that we are moving towards whatever our expectations are for practice. So those two, the expectations and assessment, are going to go together. Flexibility. So we're going to have a structured plan, some sort of framework for mentoring, but within that framework, we have to have flexibility for individual variations. There is no one size fits all program for mentoring that is going to suit every individual because we're all different. And so we have to be able to flex to what individuals need. And when we identify needs, we get to be creative in terms of how to best achieve those goals. Continual communication and feedback. So having a culture of bi-directional feedback. So feedback between mentor and mentee where it's open for both of them to give and receive feedback is really important, because that's how we're going to evolve the relationship and the mentoring over time to best suit what each other needs. And then just being sensitive to individual differences, whether it's cultural or educational or experiential differences, and recognizing that we're all individuals, and looking to always seek best and to assume best intent. Okay, so let's talk about welcoming a new doctor, or specifically a new grad, although some of these principles are going to apply for welcoming any new doctor into practice. Starting the line of communication before the new doctor starts is super, super helpful. Vets are high achievers. We're prone to worry about the unknown. And I think it's probably reasonable to assume that anybody is going to have some level of stress about starting at a new practice. So we should look at what kind of simple steps we can take to reduce that stress. And it turns out that taking these steps starts that relationship building and building that trust even before the new associate starts. So I like to think about things that we might normally classify as orientation, but they can have a huge impact from a mentoring perspective. So talking to your new associate about, what do you wear? Is this a scrubs practice or is this a white coat practice? Where do you park your car? What's the lunch culture? Are you going to host lunch for them the first day? Do people normally bring a lunch or step out of the practice at lunchtime? Just things like that to alleviate other potential aspects of worry. And also having those types of conversations with the team. So the team is preparing to adjust to welcome somebody as well. And so ensuring that the team feels like they are involved in this process and they know what the expectations are for the new doctor. I think that your technicians would probably want to know, is this doctor going to be seeing appointments right off the bat on day one? Am I going to need to change staffing to ensure that we're appropriately staffed for them? What are our expectations as team members to support this doctor? So it helps to build excitement amongst the team, fosters a culture of mentoring with them too. And then it's just going to have that ripple effect and help everybody. All right, so some other tips for starting things off right. I like to use a mentor-mentee agreement. You can find them online, or you can create one of your own. Essentially, you would think about what things you want to know about your mentee and things that you want to share with your mentee from a mentoring perspective. So what's important to you as a mentor? And you want to know what's important to your mentee to be receiving from you as a mentor. And then you're going to align where, somewhere in the middle. I talked a little bit earlier about misalignment of expectations. And I think one example would be if your mentee thinks that mentoring means that you're going to be by their side for the entire shift for the first month. And as a mentor, that's not what you have in mind. there's going to be disappointment that happens because you're misaligned. So really important to talk about those things, and then really important to continue to revisit them because mentoring needs do tend to change. So one-on-one coaching conversations, they are an investment in time. When I first started doing the full-time mentoring thing, I felt it was really important to have these coaching conversations. But I also recognized that I was asking a new doctor as well as their medical director, their in-hospital mentor, to take an hour out of their day once a month. And as someone who understands what it is to be a busy practitioner, it makes me cringe a little bit because I get what a big investment that is. But it pays off so much that once the teams that I work with in the Rochester area got used to it, they're eager for these meetings, and they are happy to set aside the time because they see the benefits of it. So you want to determine with your mentee what a good cadence looks like for these meetings. My personal recommendation is once a month for the first 6 months. And then if things are going well and you have that strong foundational relationship, we can often back off to every other month and continue those out through a year. You want to be sure that the time is protected, set aside, and that it is private so that both parties are comfortable discussing all aspects of practice. So I usually have these conversations in hospital. We'll go into an exam room, but if you're in a practice where you just can't get privacy anywhere, you might want to think about doing them somewhere outside of practice. And at the very beginning, we're using them as a way to get to know your associate as a person and as a doctor. So what do they perceive as their strengths? What are they afraid of in practice? What are their goals? There's interestingly, in my experience, there's only a few top fears of new grads, and I'll touch on a couple of them later. But it's really interesting to see how all new grads have pretty much the same fears starting out in practice. And we'll use this conversation very early on to determine what the initial schedule should look like. And again, it's taking a balance of what feels good to the mentee, what they're looking for, and what you as the mentor are looking for and need for your own hospital operations. So to prep for these conversations, you want to do a little homework ahead of time. I find it really helpful to look at a couple of medical records. So you don't have to spend a huge amount of time doing this, but I'll usually try to look at one problem and one wellness, or one problem and one anesthetic procedure, just to give myself kind of in some insight into knowledge and reasoning. How organized are they? Are they efficient and clear for the client? Are they charging appropriately? All those sorts of things. Seeking feedback from team members is really valuable too. Team members are super insightful because they're working with these mentees day in, day out, and they will often have a lot of insights that you as the mentor may not observe. Your receptionists are super helpful when it comes to getting candid client feedback. Clients will often share a lot of information at the front desk. And so that's where I get some of the best celebratory reports to share with mentees is from talking to the receptionists. But you sometimes also identify some opportunities to help coach them as well. And then metrics. Kind of full disclosure, I am not a business person. When I was in practice, I did not watch my numbers at all. It just did not motivate me. And I did fine because good medicine is good business, but I'm the type of person who's motivated by good medicine and good client interactions. But now as a mentor, I have to care because metrics are just another tool in my toolbox. And I want to have as many tools at my disposal as I can to help put the whole picture together. So I think it's really important to remember that when we're talking to mentees about metrics or financial information, revenue, and average cost of transaction, that it is never from a punitive standpoint. It is only from a standpoint of using it to put together the story and the picture of what's happening. And then I like to have an agenda to guide the meetings, because I never want to get into a meeting and ask the mentee, so how are things going? And the mentee says, oh, they're fine. And then you just have nothing else to say. And it gets really awkward. And now we've asked doctors to take time out of their day, and now we're not making good use of that time. So having an agenda ensures that we have specific things that we're going to address. And my agendas kind of evolve over time. So the 1 month agenda looks different than the 6 month agenda. I'm always willing to flex from my agenda. I encourage mentees and their medical directors to bring topics of conversation to the meetings. And that's a great thing that you can even prompt your mentee a few days ahead of time and say, hey, remember, we've got a check-in coming up in a couple of days. Can you bring a couple of things that you want to talk about to that meeting? So what I try to cover in every meeting is an opportunity to talk about any cases, address any medical questions. Although usually those types of conversations are happening more on the day-to-day basis, on the fly when you're actually looking at patients together. But we do always look at appointment schedule. We look at how the mentee is feeling in terms of volume of appointments and length of appointments. We look at client relationships. Does the mentee feel like things are going well with clients, and that for the most part they're able to pursue diagnostic and treatment plans that they're recommending? Are there any problem clients that we need to know about? Any situations with anyone that needs to be brought to our attention? Similarly with the team, how are things going with the team? Is the team being fully supportive of you, even though you're a newer grad? Is there anything that we can do to help better set you up for success? And then I mentioned earlier, I always use this as an opportunity to just do a check-in on their personal well-being. So how are things going? How is your stress level? And we kind of look at specifics like, are you staying late at the end of the day? Are you able to call clients back in a timely manner? Are you feeling stretched too thin in trying to do that? And then I take notes because just like with a medical record for our patients, there's no way I'm going to remember a few days later what I saw if I didn't write it down. So I use Loop, which is a Microsoft app, but there's any number of things that you could use. One cool thing about Loop is that it's a shared space. It can be a shared space. So if you want your mentee to have access as well, so that they can drop ideas in and you can keep track of action items or things that you guys are working on, it can be a shared space like that. But you could certainly do that with a Google document too. So I think that's really helpful. One other kind of time saver tip is that if you are feeling stretched thin as the mentor, you could always ask your mentee to write a summary of your meeting. And that has a couple of benefits. It takes one thing off of your plate as the mentor, and it also ensures that your mentee is seeing things through the same lens that you are. It's another way to ensure that you're aligned with each other. All right, so some additional benefits. Why is this investment in time and effort worth it in the long run? It's a very potent way to build relational equity and trust. And there is literature from the human medical space that it does reduce the risk of burnout. So clinicians who have regular check-ins with another clinician or a mentor had significantly lower rates of burnout. in my world, it's a really cool way to identify potential problems early, well before they would reach the threshold of anyone actually calling them a problem. And when you establish trust in this very safe environment where it's by and large very positive, these meetings are very positive interactions, it makes it so much easier to give and receive feedback, especially difficult feedback, when we have that underlying trust. All right, so let's look at some practical suggestions about a reasonable way to introduce a new grad into appointments. So this is coming from a general practice perspective. So new grad, fresh out of school, no internship, going straight into general practice. Remember, no one-way approach to mentoring, and what's right for one person is not necessarily going to be right for somebody else. But kind of somewhere in the middle, we're going to find that the first 1 to 3 days, generally shadowing, having the new grad shadow their mentor, other associates, and other team members is valuable. And then when they're ready to start seeing patients, we typically start with 1-hour wellness appointments, 2 to 4 appointments per day, and the rest of the time is spent shadowing again. And then we're gradually going to layer in some simple problems. So the ear infection as opposed to the yellow cat who hasn't eaten in 2 weeks. And we're going to increase the number of appointments per day. And then we gradually add in more complicated problems and decrease our wellness visit time from an hour down to 45 or 30 minutes until we eventually get to, all 30-minute appointments with, usually like to leave a catch-up block in the morning and the afternoon, and then eventually arrive at the full schedule. The rate at which a new grad gets to their full schedule is not necessarily predictive of success in practice. And so it's really important to be mindful of that and not be discouraged. And it's also important to be mindful and communicating with your mentee about what they need, because we don't want them to be bored, but we also don't want them to be stretched so thin that they're feeling panicked. So the other benefit of doing kind of this slow weaning onto appointments is that it allows you as the mentor to continue to see a normal, if not very close to normal caseload for yourself. So it's a really nice approach and generally works very well. And I don't know if anyone on this call recognizes this young woman. This is Dr. Erica Blair, who I have the pleasure of working with. And this was her very first patient. So that's winning if you can get that little kitten as your very first patient in practice. So the comfort zone is where everything is easy peasy, no stress. It's not a particularly productive zone. It feels good to be in that zone. And we definitely want to, spend some time in that zone. But if we're in the comfort zone all the time, it runs the risk of making us stagnant or, it actually increases the risk of burnout. The stretch zone is where we want to be. And so it's important to let our mentees know that some level of stress is good. And it actually helps us get better at what we do and learning is going to happen when we're in the stretch zone. But we also know that the next zone out is the panic zone, and I'm sure that we have all been in the panic zone, and we know that our new grads are definitely going to experience some time in the panic zone, and we want them to be able to recognize when they're in that zone, because it is not productive. It's not good for them. It's not good for their patients, not good for their team, and so they need to be able to recognize when they have moved into that zone and do something about it. So whether it's a seeking help or what have you. So, and just a reminder that nonlinear growth is normal as well. So expectations. We want to determine what our expectations are and talk about those with our mentees. Do you have certain expectations about your appointment volume and length, and by when? And these are conversations that can be had over time. You don't have to decide on day one that, hey, in 2 weeks from now, I want you seeing this many patients. That tends not to work like that, but you want to continue to come back to these concepts and address them. Same with surgery and dentistry. Surgery and dental skills are generally pretty variable from new graduates, but most individuals will need at least some supervision and nurturing, or at least a cheerleader to help give them confidence in what they're doing. Will there be need for them to work as a solo doctor? So this is one of those number one fears of new grads, is having to work alone as the only doctor. So I try to protect new grads from that through creative means as long as possible. But there are certainly some practices where it's inevitable. They're going to have to work as a solo doctor. So what I think is really important is, when that day comes, we want to be sure that they have some sort of support available to them, whether it's other people they can reach out to, just knowing what their support looks like. You can schedule creatively. Maybe it becomes a wellness only day for their first solo doctor day, things like that. Do you have financial expectations? It's not uncommon for the first year to be kind of a grace period in terms of lots of learning is happening, and there aren't significant financial expectations. But if this is a salary doctor working on production, it's fairly common to expect that doctor to be able to at least cover their base salary with what they're making. And so if that's an expectation, we want to have that conversation with them. And then just a reminder that there's no one size fits all. All right, so resources and support. Just another reminder that you are allowed to have boundaries as a mentor. Just be sure that they're well defined and well communicated to your mentee, and help them with hey, I'm not going to be available this evening, but I've talked with these colleagues. Here are their numbers, and they're all on ready to take a phone call or a text from you. You can share your favorite resources with them. I know we probably all have our favorite drug calculators and things like that we like, or discharge statements that we've created over the years. Encourage them to use our favorite websites that we love to refer to. And if you have partnerships with vendors, a lot of vendors have support hotlines where they can call and talk to a nutritionist or talk to an internist, or so there's options to get creative with getting consults that way. And if you have continuing expectations or ways to help them get access to continuing ed, that's great too. So this picture here is from a bunch of our early career doctors in Rochester, and some more experienced doctors had a strong interest in growing their diagnostic ultrasound skills. So we recently did a lab with all of those dogs and that cat are owned by the same person, and they're just the most perfect little patients for ultrasound practice. Okay, so assessment. We want to be able to have some means of assessing progress over time. So we talked about using medical record review and feedback from team members. Direct observation is going to be the primary means of assessment in clinical practice, and it's super valuable. So just observing client how they talk to clients on the phone, how they lay hands on a patient to do a physical exam, talking with them about their ideas on case management. But I wanted to use this opportunity to just dive into financial stuff a little bit more, because I think it's a really touchy subject, we are a business, and so it's really important for us to be able to have these conversations. if you talk about this stuff really, really early when it's impossible for your new grad to be meeting their base salary, there's no stress in it. You can have a very low stress conversation and say, hey, this is something that we're going to be keeping track of. It also gives you an opportunity to learn where their interests are. I mentioned that I didn't particularly watch my numbers. I knew I had leaders who did. And so if you're a leader, it's helpful to know where your mentee is coming from. So I wanted to share a really cool example. This is a case example from my experience. New grad, 6 months into general practice, and we'll say that her salary, just to make it simple, was $120,000, and she was making 20% production. So if I could only have two metrics to look at, I would look at monthly revenue relative to base salary, and I would look at average cost of transaction, because I can get a lot of information from those two things. So her monthly revenue needed to meet her base would be $50,000, but she was only at $25,000 and had been pretty stagnant for the past 3 months. There hadn't been any growth. But her average cost of transaction was $225, and we'll say that was typical for the practice. So ACT is not always a show of good medicine, but it's suggestive that this doctor was presenting appropriate plans and was getting building good client relationships of the clients who were pursuing her treatment plans. So what was going on with this? So when I had this conversation with her, it's from a judgment-free, very dispassionate standpoint. And the first thing I learned was that she had no idea. She had no idea that her revenue had been not changing over time, and that it was so much lower than the desired revenue. And I also learned that she was not motivated by that, which I assured her was absolutely fine. But I also assured her that, we want to be sure that you're set up for success when as you continue to progress on. I don't ever want a mentee to be in a position where we're trying to push them to see more patients or to increase their revenue. I want it to be very organic and natural for them. So what we discovered was that this mentee, very soft-spoken, lovely person, and she was ready to see more patients, but was reluctant to talk to her hospital leadership about opening up more slots. And her hospital leadership was reluctant to push her too aggressively, and so had not opened up more slots. So we decided, what was going to be reasonable, open up more appointment slots for this mentee. I continued to check in once we did that very regularly to be sure, are you feeling stretched too thin? How are things going? Is everything okay? She was doing great. She was loving being able to see more patients. And by the next month, her revenue had doubled. So it turned out to be just a really cool case example because it was so easy to remedy, but just a beautiful example of how it doesn't have to be a emotionally charged conversation. So just wrapping up, mentoring benefits, improved recruitment and retention. When it's done right, there are a whole lot of benefits. We can see an increased vitality of practice culture. Just bringing in a new grad, they are full of excitement. They're finally getting to do what they have committed so many years to working towards. They bring new information with them and an excitement, and that is infectious to the team. Practice financial growth. You're bringing in another person who can care for more patients, and potentially you can foster interest. If you have someone who wants to pursue a special interest like acupuncture or seeing exotics, you have opportunity to care for more patients that way. Mutual increase in career satisfaction and professional growth. There's no doubt that I'm a better veterinarian now than before I started mentoring full time. My mentees teach me stuff all the time. We learn new stuff together when they ask me questions and I just don't know the answer to it. We get to dive in and figure it out together. And it's just fun. So this is a bunch of current and former mentees at my place having a game night. So just just builds such a positive community culture. So that's all I have to say about mentoring. I do want to give a plug for the Cornell's Veterinary Educators Academy. This, if you scan the QR code, it will take you to the Cornell Academy website. This is a wonderful organization. There's a conference that happens annually at Cornell. It's coming up this June. I've been attended these for the past few years, and they are just a really awesome opportunity to grow your skills and understanding of teaching and learning in the vet profession, and to meet like-minded people who love supporting the growth of others. So it's not academic specific, though certainly are a lot of faculty there from different vet schools, but there's private practitioners, there's people from industry like me. So there's a really cool spectrum of people. And then there's also a fellowship program. If you have interest in participating in a fellowship program, we meet approximately every other week virtually and have really highly engaging interactive discussions about education-related topics in vet med. And I completed my fellows project about a year ago, but I still go to the sessions just because I learn so much, and it's such a positive environment. So thank you so much for having me, and I'm happy to chat through any questions.
Thank you, Dr. Fish. That was great. Mentorship, very important to obviously our graduating students and our young veterinarians. We don't have any questions in the chat right now. If anybody has a question, please write it there. We have a few minutes. Actually, we have two questions here, so I'm going to read in. Good friend, Dr. Irjev. Two questions. First, do you ever see or how do you tackle mentor-mentee mismatching? And do you think that it is related to differences in personality, extroverts versus introverts, et cetera? That's question one.
Yes, so great question. I have to say I've been very fortunate. I have not encountered too many situations. I'm trying to think if I've had any really substantial situations, and I can't think of any where there's been mentor mismatching. But yeah, we're all people, and it can absolutely happen. So there are ways to help minimize it by being sensitive to individual differences and really seeking to understand who the other person is and being very vulnerable yourself. But there would absolutely be occasions where there's just a mismatch. And so I think as a mentor, if you recognize that it's just not a successful relationship, it's absolutely fair to have that conversation with your mentee and then help your mentee to help connect them with someone who may be a better match for them.
Okay, and second part of that question, because it's very valid, and how important is it that the mentor and the mentee have the same type of title, like doctor with a doctor or a licensed technician with a licensed technician, et cetera?
Well, in some things, I think it's important, and in some things, I don't think it matters. So I think that if you're mentoring on clinical skills and medical reasoning and knowledge, it's important to have that shared language and experience of being a doctor. But one of my most valued mentors in a leadership capacity is not a veterinarian. And so it depends on, it kind of goes back to that idea of mentorship needs change over time. We need potentially different mentors for different skill sets. So absolutely appropriate to have multiple.
Okay, two other quick questions. As a full-time mentor in a corporate setting, how many mentees do you feel is reasonable to manage for such a role?
So I think it depends. So the way we're set up, each mentee that I have is part of a cohort, but each one of those mentees has their own in-hospital mentor that is their go-to person for day in, day out. And then my role is to help lift that burden and help nurture and I kind of feel like I'm a couples counselor sometimes, just helping them navigate that relationship. So I and our other regional mentors like me, we typically have somewhere between 15 to 18 mentees in a cohort. But then I would say for our in-hospital mentors, 2 max at a time.
Yeah, that makes total sense. Dr. Lopez has a great question. It has a little bit to do with a question that I had that I'll wait to ask if we have time. And if you have mentees that have voiced that they aren't getting the support they thought that they were going to get, and if so, what are the most common reasons for this type of scenario?
I think it all comes down to communication. Was there a misunderstanding of or a misalignment of what expectations were? And so that's why it's so important to have those conversations so frequently. So early on when I'm doing monthly check-ins with them, I used to get uncomfortable doing this, but I don't anymore. I just say, hey, mentee, is there anything that your in-hospital mentor, your medical director could do even better to help support you? And vice versa. And that kind of opens the door for either of them to say, yeah, this could be better. So it kind of puts a positive spin on it, makes it a little bit more comfortable for people to share if there is something that's uncomfortable for them. And the other thing that's interesting in having this kind of triad relationship where there's me plus an in-hospital mentor is that if there was something really, really uncomfortable, either of them could come to me. And I think and have that private conversation with me, and then we can figure out how we're going to approach it. Super important from the standpoint that we're not going to silo that information and just keep it between 2 people. We have to come back and have a corporate conversation between the 3 of us. But you can troubleshoot, especially if there's a really sensitive issue, how best to handle it.
Awesome. Thank you. I'm going to hold off my question because we're out of time. I placed a title of an article from HBR that I like. It's a very, very simple article. What mentors wish their mentees knew. It's from HBR, easy to access. Love it. Right. You need to understand what is it. The mentee needs to know what is it that they want. And so my question is going to be related to that, but I'll hold that off. Thank you, Dr. Fish. Appreciate it. I want to thank again all of you for joining us during your lunch break. I want to again thank our network partners without whom we couldn't be doing all these things. Triad Foundation, Veritas Veterinary Partners, Zoetis, IDEX, Boehringer Ingelheim, VetTriage, VPP, the Encore Vet Group, Care Credit, and Purina. We appreciate your time. We will be having a Sparkto sometime soon, and we'll get you informed the way we always do. Please make sure that you follow us on LinkedIn or on Facebook where we post these things, and then we can get the information to you so you can watch these recordings later, sharing with other people. So I appreciate your time. Thank you very much, everybody. Thank you, Dr. Fish. Talk to you later. Thanks. Goodbye.
Bye.